Sometimes when the intestine gets stuck there, even in a few hours or 4 to 6 hours, I would say. Hi, I'm Dr. Deepak Subramanian from Chennaigastrocare. What are the dangers if you keep postponing your hernia surgery? Basically, a hernia, as we all know, is a small defect through which the intestine comes and gets caught there and keeps coming and going. Now, when you leave a hernia and you keep postponing it, obviously the defect is not going to stay the same size. It's going to become bigger. So what starts as probably a 0.5 centimeter defect over a period of 4 or 5 years could become as big as a 4 or a 5 centimeter defect. Now, when a 4 or a 5 centimeter defect, more intestine can get into that hole and the swelling can become bigger. When more and more intestine gets into the hole, at some point the intestines get adherent to the tissue or the sac we call as, and sometimes can lead to what we call as an intestinal obstruction. So every part of the intestine, our food travels through every part of the intestine, gets digested. One part of the intestine being inside the hernial sac and getting stuck there can lead to an intestinal obstruction. An intestinal obstruction is an emergency. Sometimes when the intestine gets stuck there, even in a few hours or 4 to 6 hours, I would say, the intestine can lose its blood supply, and that means it is an extremely severe life-threatening emergency where we may have to remove the part of the intestine that is dead, which is basically gangrenous, and then fix the hernia. And so complicating a simple issue into a much more bigger problem is what happens when you keep postponing your surgery for a hernia. Thank you.